We are Group 14 Restore, revitalizing eating and exercising standards to optimally reverse epidemics, a youth program planning shrinking childhood obesity in low-income San Diego County families. Our main goal is to increase awareness about the risk of childhood obesity due to poor nutrition and lack of exercise. Our priority population are the San Diego low-income school children from 2nd to 8th grade and their families. These are our following evaluation questions, such as how many participants' parents attended the healthy cooking workshops, or how many participants in the program attended bi-weekly meetings.
Using the health belief model, which is regularly used to help explain and predict health-related behaviors. Beginning with this model, understanding susceptibility and seriousness of the problem and the perceived threat to the problem, childhood obesity, along with perceived benefits of participating in program workshops, perceived barriers to attending the workshops. Understanding these lead to the outcome expectation of gaining knowledge to combat childhood obesity. All this leads to the perceived ability to complete the program.
For our research design, we use non-experimental time series. We will have a pre-test, our intervention, and 2 post-tests. This will be repeated for each calendar year. X is our intervention, which will be 2 times per calendar year. The mission of our program is to increase knowledge. The pre-test post-test would be sufficient to obtain the necessary information to determine if knowledge has increased within our priority population. A comparison group would only add to our sample size, not benefit the quality of our data. For sampling procedures, we use a non-probability sample, specifically convenience sample due to certain grades in low-income schools. We also used volunteer samples because families that are interested are motivated to participate and volunteer. We will not be performing a random sample due to low-income criteria. For measuring our variables, we will do this in independent and dependent variables. For independent, that includes grade level and low-income schools. For dependent, it will be knowledge, skills, and behavior. We will measure this by pre- and post-test surveys. And for our categorical data, this will be nominal and ordinal.
In accordance with the dataset and methods used to measure the dependent variables, both univariate and bivariate analyses were utilized. Univariate data analyses encompasses measures of central tendency, specifically the mean, as well as measures of spread, specifically standard deviation, while bivariate data analyses was used to test statistical significance in the form of a t-test.
From the data collected from our survey, we were able to determine the results of 3 variables: knowledge, physical activity, and RDA standard. To determine if our intervention increased knowledge of childhood obesity among our sample, we performed a t-test, with our null hypothesis being there is no difference seen between scores of knowledge before and after the intervention, and our alternative hypothesis being there is a difference seen between scores of knowledge before and after the intervention. We calculated a p-value of 0.02, indicating that we can reject the null hypothesis and accept that there was a difference in knowledge after the intervention. T-tests were performed for physical activity and meeting the RDA standard as well. By viewing the graphs and p-values, we can see that there is a significant difference in behavior of the test sample. We can conclude that our intervention increased knowledge, skills, and behavior among our sample subjects.
In our intervention, the most likely place for limitations to occur would be in our sampling procedure. We are utilizing a non-probability convenience sample. Though this is cheap and is rich for qualitative information, which we would utilize, it cannot be extrapolated to the target population. It is not randomized and therefore cannot represent the general population. Also, a limitation to this procedure, it is hard to replicate to verify results.